Hello. Welcome to the latest edition of Tush Talks. I'm your host, Carl Bindman. Colorectal Cancer Canada is the nation's leading not-for-profit colorectal cancer patient group, and Tush Talks are our way of speaking with experts in fields related to the concerns and problems of colorectal cancer patients and survivors and their caregivers and their families, and getting them the information that they need. Today's Tush Talk is about chronic illness, and we're joined by Cynthia Herr. Cynthia is a registered social worker specializing in providing support to people living with chronic physical illnesses, as well as the mental health issues that often accompany them. Cynthia holds a master's degree in social work and has over 26 years of experience working in hospitals and community mental health organizations. She currently operates a private practice called Refined Wellness Counseling Services in St. Thomas, Ontario. When it comes to chronic conditions, Cynthia believes addressing the mind-body connection is crucial in treatment and ongoing management. Cynthia, thank you for taking the time from your busy practice to join us. We're very happy to have you. How are you doing today?
I'm doing just fine. Thank you, Carl. Thank you for inviting me. Very happy to be here.
We're happy to have you. Shall we jump in?
Absolutely.
What makes an illness a chronic illness?
Well, what makes a chronic illness essentially, when we think about it, it's any illness or condition that lasts longer than 3 months or more. So, and often chronic diseases really last for most of a person's life. And so we differentiate that from an acute illness, which is often more in the short term. And certainly cancer fits into that because as our treatments for cancer have become better and better over the years, many people really are looking at cancer as a chronic condition. And there's certainly some challenges that chronic people struggling with chronic health issues have, which is what we're here to talk about today, of course. And one of those is within the long duration that we're dealing with a chronic health issue becomes that the symptoms are just persistent. You often don't get much of a break from them. They are, uh, ongoing. People are often dealing with them on a day-to-day basis. And within that, that really is where a lot of the challenges come into play. We, unlike with an acute illness where we're looking to say, cure the illness, let's fix it, let's make it go away. A chronic condition really becomes more about how do I manage this condition? How do I live quality of life with that condition as opposed to let's cure this condition. So
Right.
the yeah. So
No,
the
please continue.
quality, yeah. So in terms of the chronic conditions, what I find is that because of the long-term nature of it, people really struggle quite a lot with chronic disease management because they know that it's in the long haul that they're going to have to deal with this. So within that comes a lot of distress. And so that really is the key challenge difference between acute illness and chronic disease.
When you say managing, what are the sorts of things that people have to manage with chronic illness beyond the illness itself?
Yeah. I mean, there's a lot of emotional wellness that we look at. So, how do I live a life where I still am mentally well as physically well? So, there's a huge, I refer to it as a bidirectional relationship between physical health and mental health. So, when we talk about mental well being when you're living with chronic disease, there are so many emotions that people find pop up when they're having been diagnosed with a chronic condition. It might be sadness, it might be frustration, it might be anger, it's often anxiety, particularly anxiety around physical health. And so it's beyond a just your general stress of I feel like my life is surrounded by my illness. I've got so many medical appointments to go to. So much of my life is taken up with taking medications, going to tests, doing all of the things that my healthcare providers tell me I'm supposed to do to manage that. It can get to the stage where it really is very emotionally distressing, and that's very, very normal. The other challenge to mental well being when you're dealing with chronic illness is this level of uncertainty. I don't, what if in the case of cancer as a chronic condition, what if my cancer comes back? You've been diagnosed, you've had treatment, you're in remission, and there's just this worry and this uncertainty. What if this comes back? What am I going to do now? What if my diabetes gets worse? What if my pain gets worse? And that uncertainty really can weigh quite heavily on people. The other part of the stress, we know that stress has a big impact on well-being. And when you're living with a chronic condition, financial stress is something I hear over and over again with clients because you often aren't able to work, for example, in the same capacity that you used to. So you're dealing also with financial strain in addition to the medical piece, and that has a real impact on your mental well-being. When
Yeah.
it And when it comes to another aspect that I find is really prevalent with people who are living with chronic health issues is this sense of losing their identity. If you were somebody who took a lot of pride in your career and all of a sudden you're not able to work anymore, that can be really difficult to manage. If you are somebody who is dealing with body image issues because you've had surgery, now your body looks different. And that can be a real hit to someone's self esteem, and there could be a real emotional toll that goes on there as well. When we think about mental well-being, it's not just completely emotional either. Sometimes there's impacts on your cognitive functioning, right? So some people may say, you know what, I'm on these medications, I'm feeling really foggy. I'm having a hard time remembering things. I'm having a hard time processing information and getting engaged and maintaining engagement in conversations. So I can start to feel really self conscious as a result of that. And some of that's just the general treatment, side effects of medication, side effects of treatment. So when we think about mental well being in the context of chronic disease management, there really are a number of different factors that play into that.
How does the patient then, if they're experiencing some of these things and they feel like they're at the, I don't know, breaking point feels severe, but at their limit, what are like signs that they need to go seek assistance from a counselor, from a psychologist?
Yeah, I think that that's an excellent question. There are absolutely some red flags that people and their loved ones, the people around them, because sometimes we don't notice them ourselves, but the people that are around us do notice them. And it's super normal, really, to feel all of those emotions, the sadness, the frustration that I didn't ask for this. Why is this happening to me? All of those, I would say, are very normal. But when you start to experience sadness that really doesn't go away, it's very persistent. You spend a lot of your time worrying about your health. You all of a sudden, well, I don't care about the stuff that I used to care about. The stress is keeping me up at night. Certainly, if you're having thoughts that, life isn't worth living anymore or harming yourself in some way, that is a huge red flag. I encourage people to certainly share that, speak to their family physician or their nurse practitioner so that they can get some treatment and get referrals for some psychological counseling. Also, a very common response to managing chronic disease is anxiety. Health anxiety is one of those that we see a lot of worry that's happening, and so I think it's important to say, well, this is normal. Don't think that this is something that is unique to you. But when anxiety gets to the point again where it's persistent, it's really hard for you to do the things that you enjoy doing when you start to have panic attacks. If that happens, certainly it's a good indication that you really should seek out some counseling. Sleep patterns. So if they're, and these are all really intertwined. We often will see with anxiety, difficulty sleeping. If you have chronic pain, it makes it very difficult to sleep. If you are dealing with bowel urgency, for example, that is something that can really have an impact on people's ability to sleep. And when we don't sleep well, it impacts the rest of our day, the next day. It impacts on, how much stress we can manage the next day, how engaged we can be with the people that are around us. inactivities and such.
And I feel
Um,
like it would
so
also certainly have a sort of impact in your ability to grapple with and deal with the illness itself as well, all of these knock-on effects, right?
yes, absolutely. All of them, the connection between physical health and mental health, it's inextricable. One goes with the other. When you're physically not well, it has an impact on your mental health. When you're not doing well from a mental health perspective because of depression, anxiety, etc., that will impact negatively on your physical health. And part of that is because it makes it more difficult when you're not um, emotionally well, it makes it difficult to stick with those parts of your treatment plan that are really important for your physical wellness, right? So, for example, if you're feeling really, really depressed, it's hard for you to even get out of bed in the morning. The likelihood that you're going to be able to do the physiotherapy exercises, remember to take your medications consistently because your sleep schedule is out of whack. All of those things have a real impact on your physical wellness. Absolutely.
And I think something that I think about in a sort of like, I feel like there's sort of a contemporary reevaluation of how we relate to our feelings, and like specificity there. I know something that I think about often is grief and how like a feeling that might be, oh, this is something sad. I'm actually not sad about it. I'm grieving something. I'm grieving opportunity. I'm grieving something else. And another one of those thoughts that strikes me as sort of entering currency more in like modern discourse around these things is trauma. Does trauma have a place in this kind of conversation in terms of chronic illness and the mental impacts of it?
Yeah, absolutely, it does. You've hit on a really key piece of information there, Carl. So, what I would say, there's this really interesting study actually when you're talking about trauma, and it's called the ACE study. ACE being adverse childhood experiences. It was, mid to late 90s, huge landmark study. And what came out of that actually is that people who experienced adverse childhood experiences, which really we would consider to be traumas, there actually were at a significantly increased rate of developing chronic disease as adults. So, experiencing trauma in and of itself makes you more susceptible to chronic diseases, especially if you had multiple traumatic events in your childhood. So, there is absolutely a very strong link there with trauma. And I would also say too that there's a difference between experiencing traumatic events and developing something called PTSD, post traumatic stress disorder, of course. And so when we think about health issues, we think about, invasive medical procedures. We think about, surgeries that ended up not going so well and there were complications afterwards. Those are traumatic. Those can be very traumatizing. And I also think, what's coming up more and more when we think about COVID. What happened back then? We had people who they couldn't have anybody with them. They were going in for diagnostic testing for cancer, for example, and there's nobody there to support them other than healthcare staff. They couldn't bring a family member in when they were getting treatments. And that was very, very traumatizing for many people. So, even within that, it's not to say those individuals went on to develop PTSD per se, but those traumatic experiences actually make chronic conditions worse. Another example, so when we're having, high levels of anxiety go along with trauma, of course. And when I think about chronic pain management, when you are feeling very anxious, when you're experiencing traumas, your nervous system is very agitated, and that will actually increase your pain. So there's all of these factors that are in play, and I think reinforce that idea behind physical illness and mental wellness being intertwined.
Something that I'm feeling right now is we've talked a lot about like the you have a chronic illness, you have cancer, it can cause all of these side effects, mental illnesses or obstacles in your day-to-day life. I'm hearing this, it's like, wow, this is kind of a bummer. So I have an illness, I have a chronic illness, and it's going to make my mental health worse, which is going to make my chronic illness worse. That's unfortunate. Why why are we presenting it this way? Why is
Mhm.
it important to say, hey, here's some potential things that can happen, and why do you feel like that's important to identify and present maybe this sort of not pessimistic view, but accurate view of the reality of what people face?
Yeah, yeah, and thanks for pointing that out too. Um, I say that in the sense that it's normal, right? One of the things that I see so often is when people are struggling, they start to make it about themselves. It's like, what's wrong with me? Why can't I handle this? This shouldn't be so difficult. And not realizing that this is very normal. And I think that there is insight that comes from normalizing some of these challenges that go along with chronic disease management. It is really important too. The message that I want people to hear is yes, these are issues, these are barriers, but they're absolutely, we can break down those barriers, we can treat those issues. When we're dealing with chronic physical health issues, if we don't acknowledge that depression, that anxiety, that traumatizing experiences um, aren't having an impact, that they're not present, if we're denying that they're there, then we can't treat them. When you go into a medical appointment and you share certain bits of information, your treatment plan is going to be based on the information that the physician or the other healthcare provider is aware of. And if they don't know that, they cannot help connect you with those services. So I'd say be honest about it, know that you're struggling, and get connected to the people that can help. It's not struggling from a mental health perspective is not a personal deficit. It's part of the picture. And in order to treat your chronic illness optimally, we have to look at all of those pieces of the picture.
Thank you. Thank you for providing that clarity. I think that's very helpful. On the level of accuracy and information, if you have this information, you know how you're feeling, you're able to talk about it. What are some strategies for helping to cope, maybe specifically for cancer patients dealing with chronic illness and chronic illness adjacent complications? But what are some specific strategies that can be employed or
Yeah.
that can be explored?
Yeah. So I think one of the most important pieces is to be an active advocate in your own healthcare journey. And part of that is to educate yourself. Educate yourself about your condition because with knowledge comes power. When you are dealing with a diagnosis like cancer and some of the chronic health issues that can come with that, people feel like, oh my gosh, what is going on? It's really disconcerting. And when you can step back and say, okay, I need to learn as much as I can about this, I need to talk to my healthcare providers. There may be, reputable websites, I would say, that you can go to get accurate information on how you can manage that. Um, the caveat that I always add to that is yes, knowledge is power, but it's really important to find the balance between being informed and doing what you need to make that happen and spending hours a day researching an illness and trying to look at new studies and being on Facebook forums. Find that balance where you can be informed and feel like you have some control, but without allowing your illness to be the center focus of your day-to-day life. So that's number one. um, Making sure that you're clear on what your treatment plan looks like and what your role is in your treatment plan. And that's going to be difficult for people to consistently stick with that treatment plan, but doing the best that you can to do the physio exercises, to take the medications consistently, all of the things, all of the components of your treatment plan. When we talk about management of some of those symptoms, for example, often people will talk about feeling pain. So, what is involved in managing your pain as part of your condition. So if it's short-term medications, if it's medications you're going to have to take in the long term, to work closely with your healthcare provider, your prescriber, your pharmacist on that. Fatigue I mean, this can be very disabling for people, just this constant state of fatigue. So again, what are some of the things that are in your control? Um, Pacing,
Mm.
knowing what your limits are and staying within them. And this can be very, very challenging when people want to do what they used to be able to do. But there is a ripple effect when you do that, is that it can make the fatigue much worse. So learning how to conserve some of some of your energy to be able to still have energy left over for those things that you actually enjoy doing in life. Um, Other symptoms, nausea, vomiting, are there some dietary changes that perhaps might alleviate some of those side effects or symptoms? Are there medications that your healthcare provider might recommend that you try taking? So, and relaxation and coping as a coping strategy. So the research is so clear around, again, that mind body connection. If you are in a stress state on a chronic basis, that will have an impact on your immune function. It's going to have an impact on just your overall physical wellness. So things like meditation, guided imagery, deep breathing, progressive muscle relaxation, all of those strategies can help you maintain a sense of a mental clarity, a sense of presence, and can really help. Again, if for example, we're dealing with chronic pain, can keep your nervous system less activated so you can better manage that pain.
Two things that you said there stood out to me. One was finding things or reconnecting with the things that you enjoy in your life, and the other was not making your illness the center of your life and of your attention. And it strikes me that those relate to a thing that we often hear about from patients and from caregivers, which is how hard it is to accept that their lives are changed forever because of their chronic illness or because of their colorectal cancer. And I bring up those two because those two seem like strategies for what the question is here, which is how to cope with that or how to manage that feeling of my life is totally different now.
Yes.
Are there other sort of effective ways to deal with those feelings, or do you want to expand maybe on what it means to do to find joy and
Yeah. So I would actually say that the finding joy in your life is one of the more difficult pieces to living with chronic disease in the long haul. Because what can happen when you feel like your life is centered around medical appointments and treatments and all of the pieces that keep you well, it can make you feel very overwhelmed, right? And so when you have the energy that you have, people focus on doing things. I have to get this done. I have to do this. I don't have time for this. I don't have energy for this. So their day ends up being about doing things that are just fairly mundane. And so they forget that it's really, really important to schedule in times to do things you love doing before you have no energy left at the end of the day. Do you love going for a short walk with your spouse? Do you love sitting out on your back porch watching, the birds? Do you really love going to some other social occasion with your family? If those things are important to you, that's what makes a quality of life, even if you have a chronic condition. So I think that those pieces are very challenging, because when we talk about this acceptance that my life will never be the way that it was, that hits hard. And people use the term new normal. And it's hard for somebody, because I don't want to accept that this is my new normal. I want my old life back. That's a big thing. I didn't ask for this. And so how do I come to terms with this? And so the word acceptance then comes into play. And I find that acceptance is a bit of a double-edged sword, because a lot of people say, well, if I accept it, then that must mean I'm okay with it. And that's absolutely not the case. Acceptance really is more of acknowledging that it is what it is. I have a chronic health issue. And there's got to be a way through this. That's what acceptance is. It's not about being okay with having a chronic health issue. So, back to emotional well being, says acknowledge these feelings, acknowledge that. Trying to accept this illness is really hard. Accepting that this is what your life is going to look like is going to probably make you anxious and sad, and that's okay. And give yourself some what we call self compassion. It's okay. Of course, I'm struggling with this, as opposed to what's wrong with me. Why can't I suck this up? Why can't I, just get on the treatment plan? What's wrong with me? Because that leads then to a whole vicious cycle of beating yourself up for not coping with your chronic illness. Focus on what you can control. You may not be able to control completely the fatigue, the chronic fatigue that can come along with, treatments that you're undergoing, medications that you have to take. But what you can control is how much am I going to push myself in these areas of my life? Do I really want to spend the little bit of energy that I have doing laundry? I wouldn't. So, what are those things that I'm going to be able to do? And set realistic expectations. If this is your new normal, there are things you're just simply not going to be able to do in the same way as you used to. If you are, somebody who loved being physically active, maybe you're even an athlete, and now you have chronic pain, that's going to look different. You're not going to be doing powerlifting with chronic low back pain, probably. You're probably not going to be running marathons. So, how can you set reasonable expectations for yourself, still incorporating those things that are really, really important to you in having it? Because that's, again, what makes our life still have a lot of meaning to it.
And that's the question, isn't it? How do you?
That's,
But I suppose
yeah.
that might be a little beyond the scope of a tush talk and maybe in the scope of seeking a counselor. I don't know.
It yeah, and it really is what I often will do with clients around that, Carl, and what does my life look like right now is what are my values? Is our family? Let's identify that. Family is my top priority. Okay, so how do we work in activities that align with those values, that love you have for family, your spirituality? How do we fit those things in every single day so that you still have that joy, that enjoyment in life, because that is what makes quality of life. And I find that um, the more discrepancy there is between the life that somebody has right now and the things that are important to them, the greater that discrepancy, the greater the distress. So let's try to align that a little bit more so that we can feel like, you know what, I have this chronic disease. I hate that I have it, but I can still live a life with it instead of it being at the center of my life.
I think that's a really strong and lovely point to maybe end our conversation on. I will just offer if you have any sort of last thoughts or if you had anything that you really wanted to mention that you didn't have a chance to talk about, I give the floor to you.
Absolutely. So I often use the analogy of the difference between acute illness and chronic illness is that chronic disease management is like a marathon, right? Dealing with a short-term illness, that's a sprint. And chronic disease management being a marathon, it takes a whole different type of skill set and a different type of focus. So I really just kind of want to reiterate that being kind to yourself, understanding that being able, like if you're somebody who is provided with a treatment plan and you stick to that treatment plan and you do everything you're supposed to, I want to say good on you because that is not typical. If you are trying to do all of the things as part of your treatment plan and some of those slip, so you find, and I'm not really doing my physiotherapy exercises as often as I should, I'm not taking my insulin as often as I'm supposed to for my diabetes. Um, Congratulations, that's normal. Normal behavior change. It's hard. It really is. So, again, back to that, it's okay that you're struggling and take those situations and treat them like a problem to be solved. Okay, so I'm not taking my insulin as regularly as I should. What's happening for me? What's getting in the way? And by treating it as a problem to be solved, it focuses it on something that we can find a solution to, and not this personal deficit, which again can really get you emotionally into some dark places from time to time. It's completely possible to manage chronic diseases. It's very possible to manage them well. It's just about being able to um, keep focus on creating those little pieces of joy in your life, and giving yourself some grace when you're not able to do all of the things that we need to do to manage chronic disease.
Well, thank you so much, Cynthia, for sharing all of those thoughts and insights. I just want to
Thank you.
let the folks know who are watching that if you have any questions or concerns, or if you want assistance in coping with your colorectal cancer or feelings around somebody that you're giving care for, you can reach out to us at colorectalcancercanada.com, or info or support at colorectalcancercanada.com. Also, you can find us on all the social medias at at Colorectal Cancer Canada, or at Colon Canada. Um, I've been Carl Bindman, your host for this Tush Talk. This has been Cynthia Herr. Cynthia, thank you so much for joining us. I just want to also extend the
Thank you.
opportunity to you. If people have any questions for you, if they want to reach out to you, how can they find you?
Yeah, absolutely. Happy to take any questions. Um, People can find me my private practice website, which is www.refinedwellness.ca, or you can reach out by email at info@refinedwellness.ca.
Wonderful. Thank you so much. And thank you again for joining us. And thank
Thank you,
you,
Carl.
dear listener/watcher, for listening/watching. Have a great day.